being confronted with a treatment option of limb amputation can feel like standing in front of a Mack truck heading at you at 80 miles an hour.
For any tripod, cat or dog.
Why do some vets do things that way?
So many people don't realize that their dogs are in pain.
Hello and welcome back to Tripawd Talk Radio. I'm Jim, and today we're diving into a topic that touches so many pet parents. Making tough decisions when your dog or cat might need an amputation, especially when cancer is involved. Joining Rene is Dr. Deanna Worley from Colorado State University, and she's here to help us understand what factors make a pet a good or not so perfect candidate for limb amputation. We'll also hear about some alternatives like limb-sparing surgeries, partial amputations with prosthetics, and advanced radiation therapy options. Whether you're facing this decision now, been through it before, or just want to be prepared for the future, this conversation is full of practical insights, compassion, and hope for our three-legged friends. Okay, here's Rene with CSU's Dr. Deanna Worley.
All right, Dr. Worley, thank you so much for being here today.
Thanks. It's a pleasure to be here.
We're so happy to have you because this topic about dogs and cats who might not be considered the greatest amputation candidates are a big worry for pet parents who are trying to decide, should I, shouldn't I? My dog is older or my dog has some chronic issues. And you've got this shadow of cancer looming in the background and you're not quite sure what you should do. So I was hoping that we could talk about dogs and cats and how you might approach the conversation differently when cancer is involved and the possibility of amputation or possibly an alternative to amputation.
Yeah, that's a great question. And I recognize that being confronted with a treatment option of limb amputation can feel like standing in front of a Mack truck heading at you at 80 miles an hour. And it can be quite jarring to have that be presented as one of the options on the table for cancer care or for any type of treatment option, honestly, since it is such an irreversible decision. The how I approach limb amputation for candidates not perfect is, I kind of share, what the pros and cons are and if they're not the most perfect candidate. And things that I've learned over time is animals that are morbidly obese, not just overweight, but morbidly obese, give me pause. Animals that have wobbliness from neurologic disease, where they're just a little bit wobbly, anything more than that, where they're knuckling over, falling over, that definitely is a kind of a deal breaker for me. But I have a little bit of I wouldn't say no to an animal that has just a mild wobbliness. That's not a deal breaker, but it is something to share of concern. Sometimes confirmation can be a point of pause or concern, but not necessarily a deal breaker for limb amputation. So some animals that have a really long spine, for instance, and short legs. However, I've had several basset hounds and dachshunds prove me wrong that do great. That's the other scary thing is that when you're in a vulnerable situation asking a medical professional for advice, what you want to hear is a guarantee that everything's going to be okay and whatever options can be presented is going to be perfect. And as a medical professional, that's so frightening just because we can't predict how things are going to go. We can counsel, we know what risk factors are, but biological systems, we're not in control of that, and you never know what's going to really going to happen. And so we do our very best with providing counsel. So going back to the kitty cat, cats are different than dogs. Cats tend to be very darn motivated. They're phenomenal creatures. They're not like dogs. And they are so darn motivated and stubborn. I honestly think cats are more intelligent than dogs. I mean, I love dogs, but there's also a higher reasoning that cats have. And what's interesting, I'm going to go on a quick tangent. Is cats
Please.
But they found that cats have fewer muscles in their face, so it's harder to understand their facial emotions, and so it's more subtle. Whereas dogs have a greater number of muscles in their face, so it's a little bit easier to see what they're feeling. But cats are much more subtle, and I find that so interesting that they're maybe emotionally maybe even more complex than dogs, but it's just harder for us to perceive them just because they have fewer muscles to change the shapes of their face when they're feeling different things. But cats are very motivated to get things done. And so I tend not to exercise or restrict a cat when they're having surgery. I may recommend a smaller space and putting obstacles on things that they think that they want to be on. Like if they need to be on that window ledge, we'll put a big box on it so they see that they can't really do that. But they're pretty darn motivated. That doesn't mean they don't feel pain, and we work very hard on managing pain. So I'm not sure if I fully answered the question yet, but for an overweight cat, I would counsel that maybe the healing time might take a little bit longer. The outcome might be a little bit, slightly, a little bit more uncertain, but would still be when I look at the goals of the procedure in terms of like, is it going to provide better quality of life? Is it going to provide a treatment option that's going to be less resource intense for the family, where maybe it's a little bit more inexpensive and allows them to move forward on whatever care that patient needs or to get the animal back at home. Whatever the goals are of the procedure, if the goals outweigh the risk, to me, then that procedure meets the goals of to move forward with the limb amputation.
That's a really good way to look at it. So you have a pet parent who says, I want my cat or my dog to be able to do this. So maybe we study our animal for a day, just watch what they do, write down. I want my cat to be able to get into their favorite spot in the house. I want my dog to be able to go this far on a walk with me. Um, Jot those goals down and then consult with their veterinarian to find out, is the surgery going to take that away? How much of that could the surgery take away? Is that what I'm hearing you say?
Yes, and I would actually take it a couple steps further. I think it also goes into what is the emotional capacity of the family to handle bumps in the road, like
Mm,
complications.
yeah.
Is the stress of facing a complication going to be so debilitating that maybe then that option isn't the right option to go if they're worried about a negative outcome? Sometimes I'll have clients project themselves 5 years in the future, and if they look backwards, what would they regret most about making a decision? And for a lot of clients, they come in to see when they see us, they're put the pressure on themselves for making the best decision. I like to flip it and say, well, what would be the worst outcome for you? Take the pressure off the best. What would give you the greatest regret in life? Then take that off the table. And it kind of flips the decision making a little bit and it decreases the stress. The other things that I think is really important is, what is your financial capability? And where your financial capability is at one point in time is going to be different at another point in time. And when you make these decisions, you shouldn't have to feel like, well, if I was 5 years later with more money, I would make the decision, therefore I should make it now. Like it's okay that whatever decision we make, we're faced with the reality of life of where we're at that point in time. And so, if you have physical limitations, like if you think your Irish Wolfhound might need a little bit of assistance getting in and out of a car, and you've had your own surgery, well, then maybe a procedure where you have to be physically present for your dog isn't going to be the right answer based on that point in time. So if you don't have the physical capability to handle that, then that's not going to make sense. If you have an animal that's going to require medication 4 times a day, but you have a 12-hour job, well, maybe that also, when you don't have the resource of time, maybe that's okay to have a decision making that requires things that are maybe less labor intense, time intense for the family. So there's a lot of different things that I think should be taken into account, and they're all valid. And what you decide at one point, or family may decide at one point, may be different tomorrow, maybe different 2 months, and that's okay. That still means the decision you made today was the correct one for that point in time.
That is so wise. I love what I'm hearing you say because we tend to put our own needs way below the needs or our perceived needs of our pets, and everybody beats themselves up because they don't have the money that they want to do what they feel is best for their animal. And so you're right. I mean, it's look at the whole picture. Look at what we need. And we do see in our community quite a few people who struggle with the recovery part because they have a back problem and they're unable to assist their dog getting up the next day after surgery. You know, the dog's really wonky and so their own physical challenges are tough. So I like that. It doesn't mean we're being unfair to our pet. It just means that we're taking the whole picture in because they're so much a part of our lives. They're just enmeshed in all these different ways. So I love that. Thank you for sharing that wisdom.
I'm
Now,
going to say real quick though, too, like
please.
even when a family decides that they can't elect an option, they're still doing something for their pet. So there's a lot
Mhm.
of guilt when people say when they're not electing one of the options that we present at our facility. I remember when I was a surgery resident in Philly, when I had an income of $23,000 a year, I couldn't afford more than a roof on the house and make sure that people had food on the table, the pets had food on the table, and they had a secure environment. That was all I could provide, but I was still providing them love and care. And so I was still meeting needs, even though they may not be higher level needs. I'm still providing things. And
Mhm.
I think a lot of clients realize when the options you present, they choose not to elect any of them. They're still doing things at home. They shouldn't feel guilty because they're still providing care and nourishment and emotional nurturing to the pets, that it's still valid.
I love that. I think we tend to forget that veterinarians have had financial challenges as they were students and getting into the profession. It's one of the biggest financial costs of education, anyways. And so we tend to forget that and we beat ourselves up, but our vets have been there too. We forget that. So thank you for that reminder. Let's say that somebody does have a dog or a cat. I don't know if limb sparing surgeries have been done on cats, but let's say that they do want to pursue a treatment that isn't amputation. And I know that limb sparing, there's a lot that's happened with it over the last 20 years or so, and the procedures are getting more refined. But can you give us a little overview of what limb sparing was 20 years ago versus where it's headed now and maybe kind of into the future?
Yeah, that's a great question. And limb sparing to me is any type of procedure that preserves some kind of functional use or physical presence of a limb.
Hmm.
So it depends on where a tumor is located on the body and what can be salvageable in terms of having a leg that's still viable. That doesn't mean the leg may work perfectly normal or like it did beforehand. So, for instance, we can have tumors on the pelvis at certain locations of the pelvis that we could take off, but we can still save the hind legs. The hind legs don't have to come off. So, tumors on the ischium and even on the ilium
Mm.
um,
Wow.
can still be a limb preserving procedure. We can have tumors of the ulna, which is another bone next to the radius on the front leg. We can take 2/3 of that bone off and have a leg that's still completely functional,
Wow.
since 80% of weight bearing occurs on the radius. And so you can take off, most of the ulna, except the very top part, what is forms the elbow joint. And so you can't disrupt the elbow joint to have a limb that's preserved. We can take 100% of the scapula, the shoulder blade, and have an animal that can walk on their leg without having a scapula. That does take a fair bit of rehabilitation, but that will work. There have been reports of tumors being removed and bones being put back together intentionally short to have a leg that still works. The old adage was you can take about 20% of the leg length and not have a noticeable gait abnormality. But we've had colleagues in the field that, based on human inspiration, that's challenged that, where you can take a greater amount of bone and still put it together so you still have a leg that could be usable, even though it's significantly shorter, and there will be at least a mechanical lameness. We talk about trying to take away a portion of the bone and either reconstruct it by fusing the joints above or below. We've had poor success with the top of the humerus. That's the long bone that goes into the shoulder joint. Biomechanically, those have failed biomechanically. Just the implants are just not strong, or either too strong or not strong enough that they fail. The implants will fail. There are some unicorn cases where the tops of the femur have been removed. That's the hip joint, and having that replaced with an artificial joint with a very, very long stem to recreate a portion of the femur. We've done things in a more palliative manner, where we have treated a tumor, left it in place, put a plate on it. Those we have lots of challenges with those, and that can get some time as well. So the future of limb spare, I think, is going, we've gotten better about treating cancer in such that we're fighting metastatic disease. And the future is going towards to go after those metastatic lesions on multiple areas of the body and to preserve them, like bore them out, put them in with cement or some kind of stabilization to kind of improve the strength of the bone that the tumor's chewing up, so that you can get more strength. We are lagging behind in veterinary medicine with that. There's a lot of challenges with that equipment and skill set and such. But that's the future, is to treat those metastatic lesions with some kind of cement and stabilization.
Is that the procedure? It's known as cementoplasty?
It is.
Interesting. So we have had a couple of members do that in our community. And one was a very large breed dog, and I believe the cancer came back in the lungs pretty quickly. And then the other one was a dog who was a Labrador-sized dog, a smaller one, who had it done at University of Florida. And as far as I know, it's been about 2 years. And as far as I know, the dog is still doing really well. But it was a pretty tricky road to recovery for that procedure. So it's exciting. So there are options. And are all of these examples that you mentioned of limb sparing, were these all animals that had cancer? I mean,
yes.
Okay.
Yes. They're the ones that have cancer. And I think the one type of limb spare that so limb spare to me is more of a global term, but oftentimes when we talk about it, we refer to a specific procedure on a specific location. Classically, limb spare in the veterinary world refers to a tumor of the radius, the lower part of the front leg, right above the wrist joint, and basically either cutting that bone out and replacing it either with cadaver bone or with a metal spacer or with some other type of implants. And I think you spoke with Dr. Tremolata recently, and I don't know if he talked about our giant breed 3D printed limb spare trial that we have coming up. And so
tell us more.
We have a new clinical trial that will be enrolling giant breed dogs to where we remove the tumorous bone. We insert a 3D printed bioresorbable construct with the plate so that we can try to help stimulate new bone growth and still have an option that could be available to the ultimate goal is to have something that's available to lots of different dogs, but the trial is looking at just giant breed dogs. So instead of using cadaver bone, instead of using a metal bone or metal spacer or using a whole lot of implants, we're using the same basic number of implants, but using a 3D printed structure that hopefully might grow bone so we don't have as many challenges with infection down the road. And so this is a trial that we will be recruiting for that's funded through the Morris Animal Foundation. But the requirements are lower radius, no evidence of metastasis elsewhere in the body, and being a giant breed dog.
Wow, that is so exciting. Now, CSU has just led the way with that type of limb spare surgery. Now, you're saying that these parts will go into the body and then just get reabsorbed by the body over
Eventually.
time.
eventually,
Okay.
and so we don't know how it will work in the dogs fully. We've had other studies under the brilliance of Dr. Bernard Segay.
Mhm.
When he was here, he was working on other types of personalized or individualized 3D printed implants for dogs. So can we, instead of having used these limited sizes, can we do something that's more 3D printed? So this is an evolution of his work, and going to a device that hopefully will stimulate more bone growth. So I mean, the holy grail would be that the animal is able to regenerate bone and not have to have an implant.
Right.
That would be the holy grail. And so there's some we're excited about what we might learn with this new trial.
Oh, that is cool. And we love Morris Animal Foundation too. They do a lot of great work. So super cool partnership there. And if the study link is on the CSU website by the time this airs, we will definitely put that in the show notes. But I'll keep an eye out for that. That's really exciting. I assume that the dogs that participate would have to live in the area.
We would need to have some type of initially it would ideal to have someone near for a period of time.
Okay. Okay. Good. Good to know. I'm so excited about this. There seems to be so much more hope now than there was when tripods first started in 2006. And so I'm really, really excited that there are people like you out there doing this work and pushing the boundaries a little bit so that our pets can have this quality of life that they might not have had way
Well,
back.
I want to make sure that credit is given to Dr. Bernard Segay, Dr. David Prowl, Dr. Giovanni Tremolata, and myself. So really, it's to Dr. Bernard Segay and Dr. David Prowl's efforts for this upcoming giant breed 3D printed limb spare trial. The other thing that you probably are aware of and your audience members are aware of is the role of radiation therapy as another
Yeah.
tool choice for treating bone tumors. And radiation therapy has been a really wonderful option to try to save bones, as well as another limb salvage, limb preserving type treatment option. And I think that our team has gotten so good about knowing what candidates could have less risks with that treatment option, that the limb spare surgeries haven't been as numerous, just because radiation options have been a very understandably attractive
Hmm.
and effective option for managing this disease in dogs as well.
Tell me a little bit about that. So, I presume you're talking about stereotactic radiation therapy and not the old school kind where a dog had to go in 20 times and that sort of thing.
Yeah, so and this is kind of thin ice for a surgeon to talk about radiation
Okay.
oncology without being a radiation oncologist, but meathead surgeon here. So the thing is with radiation therapy, we've learned with radiation biology that the bone tumors, particularly osteosarcoma, respond very well to high doses of concentrated radiation therapy over a short period of time, in a format that's delivered as stereotactic radiation body therapy, SBRT. And so that is typically anywhere from 1 to 5 doses delivered over typically a week's time.
Oh, wow.
Classically, we're doing 3 doses daily or every other day. But there's a variety of ways that the high doses of focused radiation therapy concentrated over a short period of time to target the tumor cells that's been shown effective.
That is super exciting. Is that technology becoming more widespread around the country?
It is. And so if people want to look up the Veterinary Cancer Society webpage for different radiation centers, the American College of Veterinary Radiation Therapists would be another thing to look at as well, AJ. And then the with stereotactic body radiation therapy, there's quite a few facilities across the country. It's becoming much more accessible. There are certain criteria that makes a candidate a more attractive candidate versus a less ideal candidate. So it's the same conversations that we have with limb amputation as well, or limb spare surgery. The good news is, regardless of amputation and chemotherapy or for traditional limb sparing surgery and chemotherapy or stereotactic radiation body therapy and chemotherapy. For osteosarcoma, the survival data are equivalent. So clients can take that pressure off their shoulders. Is one outcome going to be better with another treatment option? Well, overall, it tends to be about the same with any of those options. So that takes away some of the pressure with decision making. There's a couple of little nuances we can go in the weeds in, but in general, the same.
That is really good to know, because I think you want the best outcome, of course, and so knowing that pressure, as you put it, is no longer there is a huge relief. So thank you for mentioning that. Are there any other treatments out there that might be considered an amputation alternative in your world where you practice?
Another amputation. So the other option could be partial limb amputation and using a prosthetic limb. Mm-hmm. And for those criteria, our rehab group, we have a sports medicine group at CSU, and they've learned for animals that need to use a prosthesis, if they can have 3/4 of their radius preserved, of their lower leg, if they can preserve 3/4 of it, they have a better outcome with a prosthesis. The challenge is that most of our tumors involve, when we remove them, we need to take off more than 1/4 of the bone in order to have an appropriate dose of surgery to be effective. So those are a little bit limited, but when tumors happen below the wrist, for instance, a limb prosthesis could be another choice as well.
Good to mention. Thank you so much for that. I just love having all of this information here for people to access, because it's a very confusing time when you're trying to just decide, is my pet going to be okay on 3 legs? And so having you here today to walk people through it is appreciated more than you know, 1,000 times over, from all the people who will access this. Thank you.
I'm realizing one thing we didn't talk about with going back to the original limb amputation is arthritis and having imperfect joints.
Yeah, let's talk about that.
And I know that there's a lot of fear and concern. Like, my dog has arthritis, I don't know if it'd do well, or my cat has arthritis, do well with a limb amputation. Well, I will say I have not seen any mature dog that has perfect joints. I mean, as animals age, we do see arthritis to some degree in different joints, different locations. My mentor used to say, if you can't hear them walking 3 blocks away, they're going to be fine. Well, that's not, we can be a little bit more sophisticated with our criteria now. And if an animal cannot be comfortable with a good multimodal oral combination of anti-inflammatories and analgesics, then they're probably not a good limb amputation candidate. But if they're comfortable with a good amount of multimodal oral medications, even with imperfect joints, I don't have hesitation offering or recommending or proceeding with a limb amputation. Those animals, though, may require a little bit more chronic dosing of medications long-term after surgery than beforehand. There's really not much mass in a leg when you take it off. There's very little mass in a leg, which means that you're going to have the same amount of body weight on fewer joints. So there's been some thought that amputee dogs could be a nice model for studying arthritis in general. But what we've learned is that some dogs just might need their NSAIDs a little bit more regularly than they did beforehand.
I found that to be true in our community, and especially raising a 3-legged dog. Wyatt didn't have cancer, but we had him from the time he was a puppy to the time he was older. And we just found that, he's a German Shepherd, he's a bigger dog. And so keeping him on NSAIDs, getting regular lab work every 6 months, it wasn't scary. It was fine. He did great. And there are NSAID alternatives out there now that can be considered if a dog does have some kind of irregular lab work related to the medication. So I'm so glad you mentioned that, because I think you put the arthritis and amputation word together and people panic. So I like that. Just like people, we don't have perfect joints by the time we're a certain age. So I'm glad you discussed that. Thank you so much. It's really an honor to have you here. Is there anything else you want to leave our community with?
Yeah, I think there's a lot of fear of pain in our patients. And I think
Hmm.
that has been a big advancement in veterinary medicine in the last 10 to 15 years. And I've definitely seen a lot of progress in our patients and what we're able to offer. And so a couple of different things that have changed. So obviously when an animal's being anesthetized, when they're being the pre-medicated, it usually involves some type of analgesic medication. Once an animal is truly anesthetized to put them asleep, they're given some cocktail that does include a pain medication. Once they're asleep, our anesthesia team will do targeted ultrasound guided nerve blocks. So we've gotten to be really specific about regional blocks, high blocks, using nerve stimulators to make sure that what needs to be numbed is specifically numbed more efficiently and effectively. And so that has really changed in the last several years. And I am so grateful for what our anesthesiologists can do to make the
Hmm.
animals patient. Once they are asleep, they are maintained with a cocktail of drugs that does include analgesia. And then in surgery, we can provide different local blocks. And the biggest drug that you're probably aware of that has been a game changer, I see, is Nocita. That's the brand
Hmm.
name.
Yeah.
It's a type of a local anesthetic that provides numbness in the tissues up to 72 hours, so 3 days. And what that enables is that when an animal wakes up, we don't have to use as much systemic narcotics to help them feel comfortable. They can be more clear headed as they're learning how to adapt to walking on three legs without being drunk and
Hmm.
learning how to motivate. We will still provide lots of pain medications orally and IV as they need it. But having them be more clear headed has been a game changer as well, so that they won't necessarily need as many drugs for as long.
Yes, we have found huge leaps in that area for post-op recovery at home. Dogs are coming home with fewer and fewer opioids. I think sometimes, and we do get people coming home with Tylenol with codeine.
Hmm.
But compared to slapping a fentanyl patch on a dog after surgery and then saying, "Here's your dog, good luck."
Ooh,
Yeah, it has been a huge shift in the recovery. And we always say that a good recovery starts with good pain management from before surgery to after. So it's so important to have that conversation with your veterinary team before surgeries, just so you know what to expect and you know what they're going to use so that you will be aware of how your animal might present when you get them home. And we get a lot of people who panic when their pet becomes dysphoric on, whatever pain control they're home with after surgery. It's scary if you've never seen your animal in that state.
absolutely. Absolutely.
Yeah.
Well, knowing that the majority of your listeners are facing a cancer diagnosis in their pets, I'd like to let your listeners know that they do have a little bit of grace of time. A lot of times people are panicked and feel like they have to make a decision yesterday. Usually within a couple of weeks of being able to make a decision once you're presented with different options. So, take a breath,
Hmm.
discuss with the family, but you don't have to make any emergency decisions. And so there is just a little bit of grace of time when you're faced with these difficult decisions. So reach out to different specialists or veterinarians in your area. I know that CSU Animal Cancer Center, we have a client consult portal where we can give generic information, not specific necessarily to each patient, but generic information that's also a resource to clients as well as to veterinarians.
Yes, that is super important. Just because a lot of people, the first thing they do is go home and ask their friends and family what they should do. And we always say, unless that person has been in the same exact situation, perhaps you should talk to a veterinarian about it instead. It's just, it's hard to get a true perspective, even from people who are close to you, unless they have been in your shoes. It's probably best to kind of tune that out for a little bit until you talk to the pros. So great advice. Thank you. We're such huge fans of CSU for all you guys do, for pets with cancer, pets without cancer, the rehab team, everybody. Thank you, Dr. Worley. We are so happy you're here, and keep up the great work.
Well, you guys too. We love Tripawds, and we send a lot of clients your guys' direction. Sometimes clients love hearing from a lay person versus, the evil doctor team. Like, what do other people have to say? And so it's nice having you guys in our arsenal too, as a resource for clients when they want to hear from someone that's not medically oriented for advice. So we love you guys.
Oh, thank you. That is a true honor. Well, everybody, we will put all of these links in the show notes, and we'll have a transcript and everything. So stay tuned for more episodes. Dr. Worley, you have a great rest of your day. Thank you so much.
And that's all for today's episode of Tripawd Talk Radio. A huge thank you to Dr. Deanna Worley for sharing her expertise and helping us navigate some of the most challenging decisions pet parents face. If you want to learn more about limb-sparing surgeries, radiation therapy, or the new giant breed 3D printed limb-sparing trial at CSU, check the show notes for complete details and links to more helpful resources. Whether your pet is facing surgery, recovery, or ongoing care, every decision you make with love and careful thought is valid. But you don't have to go it alone. The Tripawds community is here to support you through every step of your journey. Find the help you need and connect with others at tripawds.circle.so. And if you're currently facing some difficult decisions for your furry friend, remember,
what would give you the greatest regret in life? Then take that off the table.
Thank you for tuning in. Subscribe to Tripawd Talk Radio for more pet amputation tips from experts, and claim your free gift just for listeners at downloads.tripawds.com/podcast.